using the unspent money. And we know that American Rescue Plan money came to help us get through COVID and the effects, the long-term impact of what that pandemic did to our school systems, to our communities. And we gave that money over 5 years, but we're seeing some of that being clawed back. I know that the parents that are in the audience are quite concerned about what that would mean if we actually dismantled the Department of Education. And I know, from where I sit, from the federal government perspective, it offered oversight into states, which we know the curriculums that our children have come from the state, okay, and local school boards curriculum. But we also know that public education is for every child, and adherence to civil rights, making sure that those who are disabled students have an opportunity to learn, those that are behind have an opportunity to learn. All of that oversight came from the Department of Education. Can you share with us your concern about the dismantlement of Department of Education and how that will impact Lowndes County Public Schools?
Okay. First, I want to say thank you for having me, and thank you for all that you do for Lowndes County and all the constituents that you serve. Right now, we are not exactly certain what direction Trump is going with the dismantling of the Department of Education. However, we do expect that every federal educational program will be affected in some way or another. Right now, it's just like a waiting game. We have to kind of wait and see. We've been told that some federal programs will be shifted to, like you were saying, to different agencies. However, we are very concerned that the closure of the department will pose financial, even legal or civil rights issues for local boards. And that's not something our board is, wanting to take on, but that could be the end result. The structure and oversight of the programs, such as IDEA, which stands for Individuals with Disabilities Education Act, the special education, those efforts could be cut. And in our district, we have quite a few students that are qualified as special education, whether it's gifted, whether it's speech, whether it's there are several different areas that are categorized under special education. So our Title I funds that serve children in high poverty, and we are a Title district. So all of that kind of, even Title III helps with English language learners. We have some of those, and it's just something we'll be watching closely. We are just really concerned.
Can you tell us a little bit about the school system? How many children you actually have in your school system and schools that you serve?
We have approximately 1,100 students in our district. We have 7 schools. We have 3 elementary schools, 2 middle schools, 2 high schools, and a career tech program. We also serve Head Start, we serve pre-K, and we also serve Hippie.
And I know that Alabama had used a lot of the federal funds to work on early childhood education. Can you talk a little bit about the resources for Head Start, and are there concerns about those being cut and what that would mean?
In the beginning, we weren't really concerned about Head Start, but now, recently, we are beginning to be concerned that Head Start will be cut. Head Start serves children ages 3 through 5. It's an early childhood program. It's been here in Lowndes County over 50 years. So to lose Head Start, that will be very detrimental to our community, because at that point, where would our young children go to get educational services at that age? And it does not only just serve the children, it serves the families. So there are many services that Head Start provides to our children and their families, and that will be a detrimental loss if we lose Head Start.
We are very appreciative for what you do as superintendent and the school system here in Lowndes County. My mom and all my aunts that are sitting down there are proud products of the Lowndes County school system, and so we want to thank you for all that you do. Yes. Miss Mary, I know that as a part of your job through the Alabama Agency on Aging, that you help with our seniors. And The thought of cuts to Medicaid and Medicare directly impact some of the services that you provide. Can you talk a little bit about what what services your commission provides and what areas you serve, and your thoughts and concerns about any potential cuts?
Sure, thank you. Thank you for having us at the table, and thank you for all you do for South Central Alabama Development Commission, and our heart goes out to you. But to talk about a little bit about the cuts, our agency provide a variety of program services to our seniors throughout the South Central region. And Medicaid cuts could impact our seniors, and it also could impact Medicare. 20% of our Medicare beneficiaries in Alabama also depend on Medicaid for coverage. Cuts to Medicaid may reduce access to long-term care, and long-term care is our nursing home, and you also can receive some long-term care in your home. It also will have an impact on our home health services, our home health agencies, and it also will have an impact on our seniors being able to get medication. Some of our seniors already right now are making decisions whether to get medication or to provide a meal for themselves. So we'll have a great impact on that. It also would increase a financial strain on our seniors and our caregivers in the region, and potential rise in uncompensated care from our hospital providers, because our hospitals depend on Medicare and Medicaid to be reimbursed. And the greater demand will be on similar agencies trying to find other resources in the communities for our seniors to be able to get connected to these resources. And just to share with you some of the supporting programs that we have for our seniors, we have what we call the ADRC, which is our Aging and Disability Resource Center. And this is a way for seniors to call in, to get screened, so they can determine what services we have that would be beneficial to them. We also have our Senior Community Service Employment Program that helps seniors work-based training, and we operate up on the $46.3 million grant up under the U.S. Department of Labor, and a cut
How much?
$46.3 million from the U.S. Department of Labor, and a cut to that will really make an impact on our seniors that are 55 and older that's receiving training opportunities here in the community. We also have our elderly nutrition program. We have a wonderful senior here in Fort Deposit. And we actually have 18 centers throughout our region that provide nutritious meals, social recreation activities. It gets them out in the community, keeps their mind functioning, and they have an opportunity to interact with other people, which is a great opportunity for them. We also have home delivered and frozen meals available to our seniors who are 60 and older. We have nutrition counseling where they can get one-on-one counseling to educate them about whatever chronic condition that they have, so they can learn to eat healthy food, make healthy choices, select the best food for them. We also have our Senior RX program, which gets seniors connected to medication. Sometimes we have seniors who are on, they may have cancer, and some of those cancer medications may be $1,000 just for one medication. I have seen some as much as $4,000 a month, and I don't know who can afford that. So we can actually help them get connected to those services to help them get a lower cost of medication. We have our state health insurance program that where people that have questions about Medicare and Medicaid, you can call in and get connected and find out what resource would be best for you. We have free legal services for seniors that are 60 and older. If you're looking to get your will or a power of attorney completed, the services is free for you, for anybody that's 60 and older. We have our long-term care program, which is, they advocate, we call it our ombudsman program, which is a Swedish term, and they advocate for our seniors in the nursing home so that their rights are being met and all their basic needs are being taken care of. And we have our SMP program, which is our senior Medicare program that helps our seniors detect Medicare and Medicaid fraud in the community. So that's just some of the services we provide. And like I said, a cut to Medicare and Medicaid would impact those programs tremendously.
We want to thank you and the South Central Regional Commission on Aging. All that you do has just been great. I want to remind our audience that if you have a question, you should have gotten a card, and my staff has been going around and picking up those cards. If you have a question, raise the card, and someone will come and get it, and we can have that question answered. We have about 15 minutes. So if you have a card, if you have a question at all, please hold up the card, and someone will come and get it, and I will be able to ask your question. As we're gathering the questions, I do have a question for you, Gilbert, if you don't mind. I know that healthcare is such an important part of our community, and without good access to good healthcare, we can't attract economic development. And I know that Lowndes County does not have a hospital in the whole county, so that your services are immensely important. Can you tell us a little bit about some of the challenges that you've seen so far, and what you're doing to try to mitigate against such challenges?
Well, one of the biggest challenges we see in the rural communities are our rural hospitals are closing.
Yes.
And which is a huge issue, not only for the patients that the hospitals serve, but for us as an FQHC, we don't have the capacity, the resources, the staff to handle the amount of volume that a rural hospital would handle. So those patients, typically what happens is they have to travel 30 to 45 minutes to receive health care. What would happen with us is our waiting times would be extended.
Yes.
Patient wouldn't be able to get a timely medical appointment or dental appointment. The other thing is that rural hospitals are also economic engines. So you're talking about individuals somewhere from 1,000 to 1,200 employees losing jobs right away.
Yes.
So now in the local economies, you just took away 12,000 paying individuals who utilize services in the community. So it's a big a huge domino effect. And then what happens when the hospitals leave, normally the specialists, your cardiologists, your endocrinologists, they leave with hospitals because they need hospitals to function and to provide their services.
Yes.
So when a rural community loses a hospital, it's detrimental, not only, again, just for the patient, but for the entire economic development of that rural community, and is devastating on the local economy.
Absolutely.
And so again, you wouldn't be able to attract, or you don't attract quality businesses in communities where you don't have quality health care. Yeah. So that's the effect.
Absolutely. Once again, if you have a question, please raise your card up, and somebody from my office will come and get it. I know we've received some, and I'm going to ask Melinda if she would share those.
Congresswoman, we have several questions. I want to let the audience know, if you've turned in a card and we don't get to your question, our staff, we're here, and we will be around afterwards to answer those questions. But
we will be around afterwards to answer those questions.
Yes.
We're going to get to as many as we can in the next 20 minutes.
So we've had several questions regarding the septic tank, the wastewater program in Lowndes County, and the recent DOJ ruling. We had a question from Ms. Arlene Allen and Ms. Carmelita Arnold, and it is regarding what can be done to continue to assist Lowndes County constituents as it relates to the unincorporated wastewater program and other wastewater programs that are currently with the Alabama Department of Public Health and DOJ. Congresswoman?
Thank you so much for asking that question. So first, I acknowledged in my presentation that this has been an ongoing issue. I also wanted you all to know that there are resources, federal resources, that have been sent to the state that can help mitigate against that. I see Sherry's in the audience. Raise your hand. I know you've been doing a great job of step up, stand up. The Black Belt Wastewater Authority has some resources that she received from the Alabama Department of Public Health that they got from the federal government to install septic tanks. And as I understand it, That $3.5 million is being utilized by your agency to actually, so far, over 100 homes have been, please give her a round of applause, have been able to get access to that. I just want you to know, Sherry, that we are here to help make sure, and raise your hand, to the extent that you have an issue or a problem that's that's in the Black Belt at Wastewater. Sherry's organization is one of those organizations that can help out. We also have a Lowndes County wastewater, and I'm not sure if that person's here. Yes,
I think we have some of
stand
their
up,
boards
Lolita.
people.
Thanks.
Yes.
Thank you. Want to thank you for all that you're doing to address the Lowndes County efforts. The federal government has several programs that we can access. I spoke about the rural access to septic tank, and that's where this $5 million came from. Was that bill that I passed in 2018, and of that $5 million, 3.5 go for 1.5, as I understand it, goes to Lowndes County, just for Lowndes County wastewater crisis, and then 3.5 for all of Lowndes County. That's a $5 million grant. And so far, I mean, I shudder to whisper it on C-SPANs because I don't want it to be clawed back because it has been appropriated and we are spending the money down. But we've seen in other areas this administration take money that has already been appropriated by Congress and allocate it specifically to help certain problems and certain programs, and they are taking it back. But know that your congresswoman is going to fight like hell to hold on to the money that we've appropriated for the wastewater treatment right here in Lowndes County and throughout the Black Belt, and make sure that they have hands off our money for wastewater and water system, if you're listening, the Trump administration. Anyway, so I want you to know, because I'm not afraid. Anyway, so I want you to know that there are resources out there, and I wanted to point out several of the service providers that are doing an excellent job in our community, and we will continue to work with them on that.
Thank you for that, Congresswoman. This question is from Mr. John Bowman with Hope Inspired Ministries, and his question is, their organization, they work to eliminate barriers with individuals as it relates to becoming self-employed or self-sufficient. What can you do, or can you talk about projects that would address the barriers such as childcare and transportation, particularly in rural communities?
Yes. So I want to get some of our experts on the panel to also weigh in, because I know that many of you provide transportation services and help with the access to health care and to senior services or Meals on Wheels. And so we want to make sure that you guys get a chance to answer that. But I think it's critically important that we acknowledge the social determinants of health, and one of those is poverty, and another is lack of transportation, and another is of those is about health care and preventive care. And so there are lots of social determinants of health that work against us. But I want you all to know that I know what's possible with resources and opportunities. That's why we fight so hard to try to get more of those resources to be delivered, because with more resources and better opportunities, we have better outcomes. We know that, and we're going to strive to do that. And I wasn't sure if you wanted to talk a little bit about access to Meals on Wheels. I mean, lots of these services that are up here can be provided at home. I fight all the time. I think many of you know that I had my father, who passed away 4 or 5 years ago. For 10 years, he was a stroke survivor, a 9-time stroke survivor. My mom took care of him at home. So I understand the importance of home care and the importance of making sure that meals can be delivered to those who don't have transportation. And so we fight for those resources. But can you talk a little bit about that being a barrier, but how you're meeting it, the challenge?
It's a huge challenge because our territory is actually over 25,000 square miles. And when you get into counties like Lowndes County, don't have a lot of resources and they're scattered out everywhere, it's very difficult to bring solutions for just a few people because of the cost associated with it. One of the ways that we're trying to help meet the need is we just recently announced our Food is Medicine program. We partnered with the Cancer Center, and if you are food insecure and you go to the Cancer Center in Montgomery, they will refer you to us, and once they refer you to us, we will bring 2 shipments per month delivered to your house for fresh produce and things of that nature. So we have a rural delivery system that's set up to be able to meet some of those needs, because we understand, and the truth of the matter is, out of 200 food banks in the Feeding America Network system, there's some rural delivery systems, but none that I'm aware of that go to the extent and the coverage that we're doing. But again, that goes back to funding that's needed and all the things that happen, and we're limited as to what we can do. We would love to be able to bring it to everybody's home, because we understand transportation is one of the social determinants of health, along with food insecurity, and it's a real challenge. But we are thinking outside the box and trying to tackle these challenges in new ways and innovative ways in order to lessen the burden on those who need help, especially when they're going through critical care such as cancer, kidney disease, those kind of things, those severe things that make it just that much more difficult. And with proper nutrition, if it's vital, it's especially vital when you're going through cancer treatments or serious illnesses. You need the nutrients, and so we're trying to do everything we can that way to meet our community's needs. But as you can imagine, it's very difficult.
I know it's difficult. I'm going to ask about how the transportation and at-home care and that both the Aging Commission offers as well as our health services. But before I get to that, I just wanted to just acknowledge that it's going to be critically important that we tell our neighbors about the services that are there. I mean, part of what I hope today's community conversation will do is alert you all to what the great services that are available, so that we do spread the word about what's available through the Commission on Aging and what's available at Health Services, Inc., and what's available the Heart of Alabama's food bank, as well as in our public school system. So we need to each one teach one. So to the extent that we're finding out about some information that you didn't know about, please, please, please come and see our experts at the end of today's panel to get that information. They all have really wonderful information on their websites that they can provide to you about how you can get some help. So Gilbert, do you want to talk a little bit about what you guys are offering in terms of home care? And then I know that the Commission on Aging has a lot of opportunities to provide home help.
Yeah, so several different things that we're doing. Of course, transportation is a huge issue for the residents in our rural communities that we serve. So what we've done is a couple of things. We did receive a grant to be able to transport behavioral health, mental health patients to and from their appointments if they don't have transportation. But that's only for the behavioral health side of the house for us. We're still working on the medical side. But the other thing that we've done is implemented telehealth, telehealth care, which is huge. And so
huge. Can you elaborate on that? Because they're even what do they call them? Portable telehealths that are all throughout the Black Belt that Auburn University and some others have been working to do.
That's right. So we are in the process of purchasing 4 of those pods. And we've seen that our kept appointments with telehealth are about 80 to 85%, whereas the in-person appointments, we have like a 40% no-show rate. And so our telehealth is actually working. What we're needing, though, now is approval for audio only. So to be able to call a patient on the phone is better than a patient not speaking to a provider at all.
And I did not prompt you for this, but that was one of my bills. Like during COVID, we realized that there were lots of infrastructure needs for broadband that had not reached areas like Lowndes County and the Black Belt. And so in order to better serve those communities, we allowed, Medicaid and Medicare allowed reimbursement for audio only. Now we need to make that permanent, and that's on our agenda. Obviously, our priority of my office to make sure that we get that done. But we were the ones who had that bill that got passed that helped to do that.
And we thank you for that. So that's why I brought that up.
Unprompted.
But yeah, so audio only, telehealth. And also, we have our dental mobile unit now that's, we take to each one of our counties and provide dental services at least once or twice a month. So we're trying to help with the transportation issues by bringing the services out to the patients where they're needed.
Awesome. Tell us what's going on with the commission and how you all are helping with this transportation issue.
Thank you. But one of the ways we're helping is we have our Medicaid waiver program who provide meals to our seniors who are at home and for our elderly and disabled individuals. We also provide meals. In the rural, it's hard for seniors to get out and have dependable transportation. So we have home delivered meals for our seniors that don't live right here in the city, that live out in the rural. Their meals are delivered to them daily. And we also have frozen meals that are delivered to our seniors that's in the rural. And our frozen meals are very expensive. So with tremendous cuts, more cuts, that will limit access for people to be able to receive those meals in the community.
And I know our school system provides hot breakfasts even in the summertime, and all of those are funded through federal programs. I don't know, if, Superintendent, if you want to talk a little bit about that.
So we do provide breakfast, lunch, and a snack during our summer programs. We have summer programs for our elementary schools, for our middle schools, and even for the high schools. But now some of those programs are based on grants.
I know.
So if it's a federally funded grant, then we're waiting
worried,
to see.
yeah.
So like this summer, we're waiting to find out if we're going to get a grant before we'll be able to provide those meals. But we have applied for the meals for our summer program because our children still need meals throughout the year. Some of our meals are the only meals that some of them will get each day. So we try to make sure that they are available, whether we deliver them out to the community, and we have partnerships with some churches or places in our communities where the meals are sent out to, so that they'll be closer to the children where their parents can take them to receive them.
Very good.
So
Next question.
We had, most of our questions was regarding the wastewater, the septic tanks issue, the DOJ ruling, but this is one that's kind of tied with this. They wanted to know how this program, this agreement with DOJ and the Alabama Department of Public Health, why was it considered illegal or a DEI program by the federal government? And if there are other programs that are at risk of being terminated based on DEI? This was from Ms. Lee Jackson, Jr., male.
Well, thank you, Mr. Jackson, for asking that question. So in the letter, the termination letter that the Department of Justice issued, it called the agreement a DEI agreement, diversity, equity, and inclusion agreement. Now, I said at the outset, this is not about diversity, some initiative that's about diversity, equity, and inclusion. Rather, it's a public health crisis. It's about a basic human right. Everyone, especially in this great country we live in, no one should have raw sewage in their front yard, period, full stop. So this is not about that, but they did categorize, this administration categorized that agreement as a DEI agreement. And we do know that that diversity, equity, and inclusion is under attack and under assault by this administration. And unfortunately, even the word diversity, equity, inclusion, it's as if, Elon Musk and his DOGE, the Department of Government Efficiency is what it's called. What they're doing is literally word searching diversity, equity, inclusion, and just terminating programs and attacking programs that just have those words in it, and not evaluating whether or not these are programs that are actually delivering awesome outcomes that are effectuating our well-being as people. And they're not taking that seriously. And so it is we have to push back on that. We saw that not just in the area of wastewater with this agreement, we saw it in other areas as well. You will recall that they terminated the Tuskegee Airmen part of the Air Force manual because they said it dealt with diversity, equity, and inclusion. It's not just about Black history. That's proud Alabama history and proud American history. And when we push back against them on that, they restored it. I guess what I'm saying is, we all know, and none of us want inefficiency or ineffective government. None of us want that. No one wants waste, fraud, and abuse. Let me just say that. We want effective government. But there's a way to go about doing this. And unfortunately, this administration has a chainsaw approach. They're cutting everything and wondering if it will stick. So we have to amplify our voices as American citizens to push back when we see injustice, when we see things that are being terminated that shouldn't be terminated, like the Tuskegee Airmen. We also saw that on the eve, actually the day, March 7th, I'll know it, March 7th, which was the 60th anniversary of the Selma to Montgomery March, we saw that the Doge folks had put on a list of 500 properties, federal government properties, that were up for sale. And it included the Greyhound bus station in Montgomery, which serves as the Freedom Rides Museum. Once again, we spoke up, spoke out, we held press conferences, you all wrote letters and emails, and we got that restored. So what we have to do in fighting against some of the injustices that we see coming down because of the ineffectiveness of this administration of doing targeted cuts. I mean, nobody wants ineffective government. I said it once, I'm gonna say it again. Your congresswoman does not want waste, fraud, and abuse. Nobody wants that. But there are ways to go about doing that. And it's not as if other administrations haven't done it. The Clinton administration went after waste, fraud, and abuse as well. And they studied it for 6 months, and they made every program administrator come and validate and justify their cost, expense, and what the goals were and where they met. And they made targeted cuts focused on those programs that do provide the inefficiency and are duplicative. And so I think that all of us are just, concerned. Nobody wants that waste, fraud, and abuse, but there's a proper way of going about doing this. And unfortunately, this administration seems to have a shotgun, chainsaw approach versus a more targeted one. And I think a more targeted one would be much better. But the lesson I think that we as citizens of this great nation, the lesson that we should take from that is that when we see something, what did John Lewis used to say? When you see something that's not right, that's not just, that's not fair, we all have a moral obligation to push back, to do something about it, is what he said. And so I want us all to remember that, so that in times like this, it's more important than ever for you to be civically engaged. That's why I'm so excited to see all of you here today at this community conversation. And I'm very grateful to serve you as your member of Congress and to listen and to interact and to partner with these organizations that are here to help deliver better services to you. And so we have to be more civically engaged. Those letters, those calls matter. Every one of us, every one member of Congress office logs those calls and those emails. And so don't think that your reaching out to your elected officials go in vain. They do not. It's really, really even more important during times like this that we do that. So thank you.
So Congressman, I think we have, again, if we didn't get to your question, a lot of them are about the same
Let's do another one, please.
But yes, I think we have time for two more. This one is from Ms. Harriet Means. What can be done to make an impact or encourage Congress and our legislators to pass bills for rural and impoverished areas such as Fort Deposit and other communities in the Black Belt? And this is also backing more about the septic system or the wastewater sewer system here in Lowndes County. But this question is, what can citizens do to encourage and to impact Congress to pass bills that would support rural communities?
Well, I'm going to actually, I'll take that question and I'll answer it, but I want to just say that the thing that you can do is what you're doing now, and that's being informed. There's nothing, to me, the worst thing is to have a citizenry that's uninformed or misinformed. And in this day and age, when we get our information from that phone, from social media, and sometimes we only watch those stations that feed into our own personal philosophy, that the danger is that we don't have a shared understanding of what's really going on. And that's why coming out to community conversations and town halls like this are so important, because we as elected officials, we have to be held accountable to the people who elected us, to tell them what's going on, to share with them the concerns, to take back their concerns to Washington, and to fight for resources and opportunities that address those concerns. And so what you can do is what you're doing now, being an informed citizen. It means making sure that we're not getting disinformation and misinformation, that we're really seeking to find out from the source itself what's going on. And I also want you all to know that we have in our midst these great organizations up here on the stage that do provide services, and making sure that we understand what those services are. And so the answer to that question is what I've been saying, which is that the best way to tell Congress is to come out and tell congressmen and women and senators what our concerns are and how we want them to be addressed. And I think that knowing that right now, in the beginning of the budgeting process for 2026, because that's where we are now, we're in 2026 budgeting, understanding that we have a proposal on the table, a plan of action that was actually adopted by Congress. The Senate had theirs, the House has theirs. They're going to reconcile the two, and they're going to come out with how they're going to cut. They've told us $4 trillion worth of cuts. Please, to all of you, I'm saying, stay tuned, stay engaged, stay connected, stay informed. That's what you can do. And making sure that you're letting your voice and you're amplifying your voice and making them being heard to your elected officials at every level, not just the federal, the state and local level as well. And remember, our district is a district that was born out of civil rights and voting rights, a proud history of fighting, ordinary people fighting for civil rights and voting rights. And so we have to vote in every election, whether that's school board, yes, come on, school board, state, your county commission, your local mayor's race, all of those are important. And please, please continue to do that. With that, I want to thank our guests. Please, please give a round of applause to our guests. I want to thank my amazing staff. Please thank the staff for their wonderful efforts. And, you know, these are our taxpayer money that pays for our staff, and they have been an amazing staff. We are all an extension of this great staff. I want you all to stay tuned and stay engaged and stay informed. And I want to thank you for the opportunity to represent you in Washington.
Thank you. Let's give the panelists a hand. We appreciate you being here. And let's give it a big hand to our wonderful Congresswoman who fights 23 hours a day for the 7th Congressional District. We're going to ask Mr. Boone if he would come to give us a closing prayer. We want to remind you that our staff is here. The panelists will remain.
And your Congresswoman will remain to answer any questions that you did not want to share with the public, but want to have. We will stay around. Thank you.
Thank you. Closing prayer.
Dear Heavenly Father, thank you for allowing us to gather here, Lord. And Lord, I ask that you touch everyone, Lord, as they enter their vehicle, Lord. Give them traveling grace to make it home or to their destination. In your son, Jesus' name I pray, amen.
Amen. Thank you very much. Thank you all. Thank you for a successful and a very informative panel.
Thank you for being here.